70-year-old Pauline Kemunto is just one among many people in Kenya and the world over suffering from chronic kidney disorder. Having lived with high blood pressure and diabetes for over 20 years, Pauline was susceptible to kidney disease, a condition her doctor discovered early this year. Unfortunately, her condition was already in its advanced stages.
It was in January this year, and the symptoms were breathing was difficult, and I had a swollen tummy, as if, I had overeaten. So my children discovered that they could not wait until the next day. So they said, we take you to hospital so that we know what is the problem.
The function of the kidneys in the body is removal of waste products and excess water from the blood. Basically, kidneys process about 200 liters of blood every day and produce about 2 liters of urine. The waste products are generated from normal metabolic processes, including the breakdown of ingested foods, active tissues, among other functions.
So these are just but a few of the functions that the kidney does. And when the kidney starts failing, all these are interfered with. The byproducts of metabolism start increasing in blood, and they've got quite a number of problems in the whole system, not just with, let's say, just an increase. As far as blood pressure is concerned, quite a number of patients have got a problem with the blood pressure. The blood pressure starts rising. The water, as you probably have seen, in the patients who've got kidney disease, the body starts swelling because the body is not able to excrete the water adequately.
Twice a week, Pauline goes for dialysis at the Karen Hospital, where she receives specialized treatment and care. And here, a dialysis machine acts as an artificial kidney, cleansing the blood and getting rid of excess water and waste, controlling the quality and quantity of fluids in the body. The dialysis process also allows consumption of foods, drugs, vitamins and supplements together with excess fluids without worrying that toxic byproducts will build up to harmful levels in the body. In other words, dialysis ensures the body is not intoxicated as a result of kidney malfunction.
We've got basically two forms of dialysis, if I may put them broadly. We've got what we call hemodialysis, and the second one is peritoneal dialysis. Hemodialysis, normally patients come to us, they come to hospital or to some dialysis centers that we have around the country. And the dialysis is done for the patient by the staff, the hospital staff. Another one known as peritoneal dialysis. Peritoneal dialysis, you actually don't see any blood circulating. What we do is to use a special fluid known as peritoneal fluid. We put a catheter or a plastic tube inside the tummy, okay, but not where the food passes through. There are two thin membranes that line the stomach and the intestines, and there's a space in between. That's where the catheter goes in, and that's where we put the special fluid. The concentrated fluid pulls the toxins from the blood.
Some signs and symptoms of chronic kidney disease include change in energy levels, increased water retention, shortness of breath, nausea or vomiting, lightheadedness, easy bruising, and itching.
But God is great.
With no regrets about her condition, adding that she's lived a long and good life, Pauline says she does not need to take a kidney from someone else. However, one of the challenges she's faced is the cost of dialysis.
So we agreed with my children to sell a house I had at Jamhuri Estate, from where I'm getting the money which I bring to hospital. But it is going very fast.
Nonetheless, support from friends and family has kept her strong and going, with her positive attitude being her main source of strength.
And that makes me smile. And I'll continue smiling until the day I cannot smile anymore.
So, what are the causes of chronic kidney disease?
Uncontrolled diabetes, which has been there for quite some time, quite a number of years, results to end-stage kidney failure. Another common cause is hypertension. And the third one is some inflammation that affect the kidney, known as the glomerulonephritis, which, if not well treated, can result to kidney damage.
Sometimes chronic kidney disease shows no symptoms in its early stages. That means anyone at risk should be routinely tested to check for any developments of the disease. One of the tests that can be carried out to detect if you have chronic kidney disorder is urinalysis, starting with a dipstick test. The dipstick has reagents that check the urine for the presence of various normal and abnormal constituents, including protein. The urine is then examined under the microscope to look for white blood cells, casts, and crystals. A blood cell count can also be done to detect kidney disorders because chronic kidney disorder disrupts blood cell production and shortens the survival of red cells. The blood cell count and hemoglobin may be low, leading to anemia. Also, abnormal sugar levels can be indicative of this condition. People with diabetes and who do not control their blood glucose have a much higher risk of all complications of diabetes, including chronic kidney disease. An ultrasound can be done to detect abnormal size of kidneys or shrunken kidneys. An ultrasound can also be done to detect abnormal size of kidneys or shrunken kidneys. An ultrasound may also be used to diagnose the presence of urinary obstruction, kidney stones, and also to assess the blood flow to the kidneys. Also, a CAT scan or CT scan can be done. This scan reveals the minor details of the kidneys and is more extensive in diagnosing chronic kidney disorders. The CAT scan image is usually two-dimensional, and details that were not seen in the ultrasound scan will be clearly visible in the CAT scan. Chronic kidney disorders can interfere with the absorption of calcium and phosphorus in the bones, causing weakness and painful bones. One of the problems caused by kidney malfunction is anemia. This is a condition characterized by a low red blood cell count in the blood. Others include high blood pressure, excessive acidity of body fluids, and cholesterol disorders. Apart from going for regular checkups, what else can one do to prevent themselves from chronic kidney disease?
We are living what we call a sedentary lifestyle. We are not very active. We sit in our offices for far too long without doing any exercises. Our food that we eat, we've run away from the traditional foods that our parents, our great-grandparents used to eat. We've gone to what we call, the fast foods, which unfortunately are very unhealthy. Okay, they make us add too much weight. And the more you add weight, the higher the risks of getting a condition like diabetes, especially if you've got the genes, okay, that may predispose you to diabetes.
As much as chronic kidney disease cannot be prevented in some situations, you may be able to protect your kidneys from damage or slow the progression of the disease by controlling your underlying conditions. And if you are at risk of developing chronic kidney disease, see your health practitioner for monitoring and screening tests. But if you are already suffering from chronic kidney disease, a positive attitude and following the recommended treatments religiously are definitely essential. Zein Noor reporting for Sunday Live.